Hi, my name is Michael DeSanabin, and it's my privilege to present to you all today. ViRS, or the Visual Response Simulator, is an outbreak simulation and modeling tool designed to visualize disease outbreaks and analyze the predicted effects of user control intervention strategies. But before I tell you more about ViRS, I'd like to start with my own story. My background is in architecture and design, and back in early 2015, I had the incredible opportunity to work with a public health NGO to conduct healthcare facility assessments and create design solutions for government hospitals in Sierra Leone and Liberia during the Ebola outbreak. This was an incredibly eye-opening experience for me, and one obvious takeaway from it was just how complex and multifaceted the problems are that response organizations and local governments were facing. My team was helping by addressing some of the small-scale problems through architecture, but to really understand all the major issues, you have to take a step back and look at it holistically from a systems level altitude. The experience in West Africa had such an impact on me, it drove me back to school to pursue a career in the humanitarian field and see what I, as a designer and spatial thinker, could bring to the table. While enrolled at the Harvard Graduate School of Design, I took courses in computer science, mapping, public health, and humanitarian response, and for my thesis project, I started to build ViRS, which is an interactive agent-based outbreak simulator that can integrate real-world GIS data, such as road networks and health facility locations, with a population of agents that have programmable decision-making behaviors, where a user can deploy and test outbreak response interventions through an easy-to-use graphic user interface. Due to its interactiveness and visualization characteristics, ViRS operates more like a video game than it does your typical infectious disease model. It also has advanced data visualization and recording capabilities, which allows the user to compare the results and effectiveness of different response scenarios that they create. Today, ViRS continues as an ongoing research project, and it's our team's mission to develop ViRS to be utilized as a decision support and planning tool for humanitarian organizations and local ministries of health responding to outbreaks. However, we believe that ViRS also has great potential to be used as a training and learning tool in between deployments. Although ViRS began as my personal thesis project, there is now a growing and stellar team behind it. We're based out of the Harvard Humanitarian Initiative, where we have a core group of GIS and humanitarian researchers. And with the seed funding from HTC, we're now able to add an experienced infectious disease modeler and interactive gaming company to the team. At this point, we have the Ebola prototype that I've been working on since graduate school, but with our new team of experts, we're about to embark on rebuilding the prototype from the ground up with the hopes of having operational partners participate in user feedback and user research sessions. And that's where you all come in. If you work for an organization that you think would have interest in this tool, we'd love to hear from you. Having operational partners that can provide critical user feedback, insights, and data streams will be essential for the success and eventual adoption of ViRS in the field. Or if you're just excited about ViRS and believe in its mission and can potentially offer financial support, we'd love to hear from you as well. We're still in the early stages of this endeavor and need all the support we can get to make ViRS a success and fulfill its potential to have an impact on vulnerable, resource-limited communities facing compounding health crisis. Thank you for your time.